So what are we talking about when we say volunteers? And in the Canadian context, in 2013, in a survey, we would have said 47% of Canadians volunteer. So those who give their time to formal organizations in service to the mission. And that would have worked out to be, just over 1 million full-time jobs, and that would have been within one of the many 800,000 plus registered charities in the Canadian context. In 2018, the survey definition was broadened to talk about informal volunteerism. Are you helping your friends and neighbors in a way that doesn't get captured? And when you do that, more than 80% of Canadians over the age of 15 say they volunteer to support health and well-being of their fellow citizens in their community. And so I gave you a chart to show the number of hours that are being allocated to various sorts of organizations. And it's going to be interesting to see what happens post-COVID with the incredible rise of community response and mutual aid. And so I provide this as an opportunity for us to frame the discussion. I saw there was a question around what do we mean by volunteers? I like to use the WHO definition, which is anyone who is working in human resource for health and who are paid, unpaid, or volunteers. And that's a 2009 definition. Now, of course, we have to think about what do we mean by the voluntary sector, the third sector, where does that sit? And so, I've had participants of studies say, we're really talking about the organizations that are both a destination, we think of it as a destination, but they're also our partners in supporting health and well-being. And someone said to me, well, these are really the services that are close to where you work, play, and sleep in your own bed. And so the idea of what are the characteristics of those third sector organizations, I've provided them to you. Third sector is a term that has been used to describe organizations that are not public nor private, and has been used to describe nonprofits, think tanks, registered charities, self-help, mutual aid, social enterprise, etc. And so those are the characteristics of. I would be remiss if I didn't point out, though, that the context of third sector is grounded in the socio-political context of your locale. Emma Sachs and colleagues, noting that community health was identified in the UN Global Health Strategy as an essential component of system resilience, noted that in the WHO health system framework, it was insufficiently addressed. And so they have repositioned this and convened through a convening of a like-minded collaborative group, have positioned where community may sit in the building blocks. And so I've given you the citation. The framework is really helpful. It's also really helpful for policymakers thinking about how to recognize, prioritize, and invest in the aspects of health systems that could promote broader considerations for health. I'm not going to go into great detail on that. The next slide provides a nice framework to talk about what is community-centered approaches for care. And this is a framework that came out of Public Health England, the NHS and Public Health England. And it's really the idea about focusing on and thinking about community assets to promote health and increase access and equity considerations. And so they've positioned 4 broad buckets, and it's a family of framework. So I'm going to be interested to know if the experiences that you have in your volunteer opportunities, if in fact they align to any of these. And I'm sure many of you on the call either are working or have worked through services that align to one of these. For example, I saw colleagues of mine talking about pathways for participation. The idea of social prescribing is a great opportunity to think about pathways to participation, third sector engagement. So, much of this is really built on the assumptions that the interventions held within this framework can reflect partnerships and a support integration. Many of these domains have great examples of community-centered practice, and I suspect Vicki will flag this, that one of the challenges that they're now sort of seeking to address is the scaling up of these approaches, the diversity of grassroots responses to the direct needs of their citizens and community members, and then to determine how you do that at scale and where it links to the more formal established healthcare services. So I provide these 2 frameworks because they're 2 of the ones that I use a lot. if we go to the next slide, I just want to talk for a minute about the promise and challenges, the promise and pitfalls of collaboration, intersectoral collaboration with the third sector, the voluntary sector, as it's often called. This isn't a new concept, and we have talked about collaboration across sectors and services to support addressing public health challenges, smoking cessation, for example. We look to intersectoral partnerships to address inefficiencies or talk about resource availability and considerations. We talk about leveraging the expertise and opportunities for the extension of or meeting the needs of citizens where they are. We talk about in the intersectoral, the motivations. We talk about how do we do more and align our work for collective impact, that idea of that we're all working to the common good. I put the expectations in reality, and you can see that both arrows actually eventually make their way out to, pointing in the same direction. But there is this challenge and some struggles in the collaboration. And so I suspect many of you in the discussion or Q&A will identify some of these. But collaboration doesn't exist in a vacuum. We need to think about the collaboration between the sectors and evaluate them within the context that you're working in. There's a substantive literature. If you have Google scholar searched voluntary sector health services, there's thousands upon thousands of articles, but it sits across clinical, social care, voluntary sector, gray literature, and so it's difficult to find the articles to inform your approach. We often see differences in philosophical alignment, approaches to collaboration, decision-making processes, competition for power, the resource asymmetries, who has and who doesn't have a lot of resources, service philosophies, and accountability considerations between the organizations. One of the things that's really interesting is that in the literature, it's hard to find evidence of impact. There's a systematic review that was just published. If anyone's interested, I can share that noted that there's evidence around collaboration, but not evidence for health impact. And so I wonder, that's an opportunity and a gap that we can address. And then the scalability, and I think we'll hear examples of that. What I wanted to flag, though, before I finish my 10 minutes is that despite the conversation, despite the evidence, despite the ongoing international conversations, we're still under recognizing. We're under studying, under recognizing the potential value, and so this webinar and other work allows us to address that, bring it to the fore. So if you are sparked, if you have interest and this has whet your appetite and you want to dig in, join this special interest group through IFIC. I've given you a QR code that'll take you to the sign up page, or email me and let's continue the conversation.